Okay, so we have provinces blaming the lack of supply of vaccines from the federal government for the delays in the vaccination process in some provinces. The federal government insisting, look, provinces are getting the supply, so it's up to them to roll it out quickly. Is it time for the federal government to take a more hands-on approach to dealing with the third wave and the challenges facing some provinces? And if so, what more should Ottawa be doing? Let's bring in three members of Parliament to discuss that. Jennifer O'Connell is an Ontario Liberal MP, Parliamentary Secretary to the Minister of Health. Erin Duncan is an Ontario Conservative MP and the Question Period Coordinator for the Official Opposition. And Don Davies is a British Columbia NDP MP and his party's health critic. Good to see you all. Jennifer O'Connell, let me start with you. We heard from the premiers of Ontario, Alberta, Saskatchewan, and New Brunswick today, all once more lamenting the supply of vaccines from the federal government and blaming that for the delays to a large measure in vaccinations in their own provinces. How valid is that criticism?
Well, I mean, I think the point is that we have been delivering for Canadians, for provinces and territories. Originally, if you remember, we had anticipated delivering in March 6 million vaccines. We've actually exceeded that. And in March, we delivered 9.5 million vaccines. To date, we've delivered 11.7 million vaccines. And this week alone, we anticipate another 1.9 million vaccines. So I understand there is some local frustration, but the point remains, not only are we delivering the vaccines, we actually have been exceeding those targets, and we've been keeping provinces and territories in the loop every step of the way so they can make these local planning decisions. And that's what we'll continue to do.
Mr. Duncan, we've also seen conflicting information that shows provinces have supply but can't seem to get it administered quickly enough. But we've also seen today 2 hospital clinics canceling 10,000 vaccination appointments because they have no supply. What's the problem here as you see it?
Miscommunications and not delivering on their promises. The goalpost the Liberals have set for themselves is very low. Say, oh, we promised this and we deliver. They're 300,000 Moderna vaccines that were to be delivered to Ontario this week that are being delayed. In Manitoba, Peter, they had the same situation where they had to go and make 27,000 phone calls to rebook appointments. They're not delivering the way and as smooth as they should be doing.
So what if Moderna doesn't if Moderna doesn't ship the vaccine, whose responsibility is that? How do you, if you're planning to get the supplies and they're a week late, how do you fix that?
These go back to volumes, though, Peter. We're 62nd around the world when it comes to vaccination rates. We're behind. We look at the US and the UK. When if you have larger volumes, you get more people that are vaccinated. And again, we're seeing now a direct correlation between this third wave because we haven't had the volume of vaccines. So when the Liberals say, oh, we had a goal of 6 million, it's nowhere near enough. We need to go off what the US or UK model should be. And that's why it's this complete chaos and not delivering. And again, that goes back to contracts and guarantees that the government should have been securing for companies.
We'll circle back to some of that. Mr. Davies, what more should the federal government be doing to ensure the vaccine rollout's moving more quickly in the provinces?
Well, I remember last October, Peter, calling for a national vaccination plan as the U.S. was developing, and they had one in place last November. I remember Prime Minister Trudeau saying we needed a Team Canada approach. We needed all hands on deck, and I think that's where the breakdown has come, is instead we've gotten into this finger-pointing blame game. It's like Prime Minister Trudeau's in a plane flying over a burning country and pointing down and saying, well, this is the province's responsibilities. Canadians aren't interested in that. They want concrete results. So we need to use all tools at our disposal, and that includes setting up federal vaccination sites. It includes having a national vaccination plan, like other countries are doing. Germany is doing it now. Other federal states are recognizing that this virus doesn't recognize borders and that you need a coordinated national response. And to Jennifer's point, it can't be that there's a third wave in Ontario and Quebec and Alberta and BC, and it's all the Premier's fault. This is something that has to be recognized as a national problem, right. And I think we need the federal government involved more so than they've been to date.
Let me go back to Jennifer O'Connell. Let's look at where we are, Jennifer O'Connell. Canada now has a higher per capita infection rate than the U.S. We have vaccination clinics shutting down because they don't have supplies. Less than 20% of Canadians have had their first shot of vaccine. We have children's hospitals now in Ontario caring for adult patients because the hospitals are overwhelmed. Canadians are wondering what's happening here. What can you tell them?
Well, I think that that's precisely why our government has been asking Canadians to continue to do the hard work that we know is needed because of these variants of concern. And I mean, in fairness, the last time I was on this panel, we were here because the Conservatives were saying, let's just reopen. And in the UK, if you use that as an example, they are ahead in terms of vaccination rates, but they are actually going into a third wave and additional lockdowns. And it's because we need to make sure that we are delivering on vaccines and that Canadians are getting the vaccines they need. But we also have to have measures
to Mr. Davies'
in place.
point, should the government be considering, look, if the provinces are struggling, let's open federally operated vaccination clinics in the provinces, I think is what Mr. Davies is saying. And I mean, the provinces might not like that, but should we be thinking about that?
Well, I think let's look at our track record. When provinces said we need more PPE, we procured it, we delivered it. When they needed rapid tests, we approved, procured, and delivered. When they needed lab capacity, we opened up federal capacity for labs.
Right, but now they're saying they need more
vaccines, exactly. And that's why we've delivered even more than we had originally anticipated. And we're not going to stop.
Mr. Duncan, should there be a larger federal role here, to Mr. Davies' point? If the provinces are struggling, does the federal government now move to step in and say, if you're having trouble, we'll do it for you?
Well, and I think they need to be there in a leadership role to do that. At-home testing, like the United Kingdom, if there is at-home tests or rapid tests procured, they should be offering like the UK does at home for those who want it. There's other tools and other strategies. They've been late to the game on many of these things. And Peter, I've spoke before my frustration on rapid testing and the approval process there. And other countries, again, are light years ahead of us. We need to be checking on the ICU surge capacities going on right now. But frankly, just keeping to their delivery dates at a very minimum and conflicting information. And I will just say, if you know they're in the wrong direction, say, well, look at our track record. They're not wanting to do that. The Prime Minister was referring the other day saying the UK is in a third wave. Is absolute nonsense. Their cases are going down. The number of deaths, thankfully, are going down. They're reopening, enjoying their pubs and restaurants. We're going in the absolute opposite direction.
Mr. Davies,
there's a direct correlation.
Okay, Mr. Davies, should the federal, we're starting to hear this proposed now. Should the federal government consider sending more vaccines to the hardest hit provinces and cities such as Toronto and reduce the shipments perhaps to the Atlantic provinces, for instance, where the third wave is hitting but less hard?
Well, this again speaks to national coordination. I think it's a fluid situation, Peter, and we do have to be nimble. So I think that as the science emerges and as we see vulnerabilities emerge in different parts of the country, we've got to have the ability to respond to that. And that only can happen on a federal basis. And I do want to say that I'm not suggesting that the feds do the vaccinations for the provinces. I'm suggesting they do them with the provinces. We need all hands on deck. And, you know, we had Major General...
But how willing do you think the provinces will be to say, I mean, that's essentially a concession that they're not able to do the jobs themselves. And I don't think you're going to hear too many provinces suggest it's okay for the feds to come in and take over or join us in the vaccination process. How do you think that works?
Well, you know, I'm not concerned about that, Peter. I mean, I think every premier wants the citizens of their provinces and territories to get as many vaccinations as possible. And if it's done in a coordinated way, where there's quicker access to jabs, what premier would stand up and say he or she doesn't want that? You know, I will say Major General Fortin came to committee repeatedly and told us that provinces were ready to do the vaccinations. That's clearly not the case. And so the question for the federal government is, do they sit back and just let disaster unfold? Or do they step in for Canadians? We have a larger responsibility to the Canadian public than we do to the premiers.
Very quick answers from Jennifer O'Connell and Erin Duncan. Should we be looking at apportioning more vaccines to parts of the country where the wave is hitting hardest? Jennifer O'Connell?
Well, thank you. Well, we are delivering vaccines as promised to provinces and territories, and NACI has provided guidance and advice in terms of the distribution to target, you know, vulnerable areas, and we hope that the provinces and territories will take that advice.
I'm asking less vaccine, let's say, to Atlantic Canada and more to Ontario and Quebec.
Well, I think as of now, we've provided the schedule to provinces and territories, and we're going to keep working with them. And any premiers that have challenges, we will be there to support them and help them.
Mr. Duncan, what's your view here in the last 20 seconds or so I have?
Going to be a very tough sell, I think, to start saying to one premier, look, we're going to give up vaccines, because vaccines, we were told and we're told until the Prime Minister says that's not the be all and end all now, but it helps keep people safe and allows a reopening to get back to some form of normalcy to get through this. So to go to one premier and say, no, we're taking them and putting them somewhere else, I think we're starting now a dog-eat-dog world. We're starting to pit provinces against each other in resentment. This is the last thing that I think we should be having when what's going on. It's just a terrible situation.
Thank you all for your time tonight. We'll continue to follow this story as we do every day. Thank you all, and take care.
Thank you.